My name is Kelly, and the purpose of this video is how to perform a self-breast examination. I will be focusing on the look and feel of how to do self-breast examinations. It is important to perform these exams at the same time every month at the end of your menstruation cycle. If you are postmenopausal, then the time of the month does not matter. Make sure that when you feel for inspection of your breast tissue that you are using the 3-finger method and you use the pads of your fingers. This is because using 1 to 2 fingers can give the impression of any nodules that are not there. So 3 fingers is the most accurate. You can choose the vertical method or the circular method in order to inspect your breasts. Both methods start at the upper outer area of your breast beneath the collarbone. The vertical method starts at this position and it goes down and then to the side, and you are going in up and down motions along the breast tissue. The circular method starts in this upper outer area, works its way towards the center of your chest, down along your chest, underneath the breast tissue, and then up again towards this upper outer area. And you work in circular motions until you reach the center of the chest area. The vertical method is most recommended, however, the circular method is most popular. Please make sure you use the one that you are most comfortable with. When you are palpating the breast tissue, you are using different pressures, a light, medium, and deeper pressure, in order to make sure that you are feeling all of the layers of the breast tissue. You will begin this examination by standing, your top removed, and in front of a mirror in order to inspect the breast. You are looking at the size, shape, color, and symmetry of your breasts. The color should be consistent with your skin color. The size should be similar or slightly irregular, with your left being slightly larger. The symmetry of your breast should be as similar as possible. And note the nipple area as well from month to month, making sure that there are no changes in the size or color of the nipples. Any redness, abnormal skin color, size changes should be a reason to see your physician. Start with both hands behind your head in order to see if there's any dimpling that occurs when you put your hands behind your head, or any changes in the nipple area, and observe for symmetry. Gently palpate and press down on the nipples and squeeze, noting any tenderness or discharge. Discharge is abnormal unless you are pregnant or breastfeeding. Now start with one hand behind your head and feel using the vertical or circular method, noting any abnormal lumps or tenderness. You will also want to put your hands on your hips and inspect for any abnormalities. Breast tenderness, swelling can indicate a possible infection. You'll want to feel for lumps as you are doing the vertical or circular method, and especially feel under the armpit and along the side. You will also want to feel in this outer quadrant, because this is a tale of Spence, and most cancers occur in this area, so it's especially important to feel in this position. Next, you are going to lie down, and you will have one hand behind your head and put a pillow behind that arm. In this position, it helps to flatten the breast tissue so that you can feel any possible nodules. It's important for this position because you are focusing on the feeling of the breast tissue rather than the appearance and looking at your breast tissue as you are when you're standing. So now that you are lying down with your opposite hand in the 3-finger method, feel the breast tissue using the same method that you did while you were standing. Then change so that you have the other arm behind your head with a pillow behind it, again to flatten the area, and use the same circular or vertical method. If you have any questions, concerns, or note any abnormalities during your self-breast examination, please contact your physician. You should also be familiar with your family history and seek out family members to find out whether or not you have a history of breast cancer or any abnormalities involving your breast tissue. If you do, earlier breast tests may be necessary, and monitoring yourself closer in order for early detection and preventing breast cancer. Thank you, and I hope that this video was helpful.